One evening after a party, I started feeling some pain. I thought maybe it was just a simple toothache at that time. This was something I thought would go away over time, and it never went away for that entire week. I later realized that I'm starting to grind my teeth at night, which they think was maybe part of the cause of the bone loss. I didn't want to exacerbate the problem, and so I consciously made the effort to chew on the opposite side. I began also to change the foods that I was eating as well, and staying away from crunchy foods. And every time you eat, you have to remind yourself, what side to chew on. So when I first came to Green Lake Oral and Facial Surgery, I didn't really have an idea of what to expect. I actually was kind of surprised. It was a really modern looking office. I had a really good experience with the people at the front desk. I was educated through the process itself, and the insurance especially, because normally when you go into a dental office, you don't go over the process of what the insurance will cover and what it won't cover. And so by them explaining as to what it would cover per type of procedure I was having done was very helpful.
Rich came to us with a long history of dental work. He had his first fractured molar when he came to us, and we had to educate him about the process of restoring that tooth with an implant. And this was his first implant, and he didn't have a lot of understanding about what the whole process entailed and what was coming next for him. We replaced the implant to replace that fractured molar, and now he has a lot of confidence and understanding about how implants can replace teeth. In his case, went extremely well. It's very smooth, and it's just an example of how when we execute the procedures well, the outcomes are great and the patient can have wonderful trust with us and have a good experience.
I feel that I don't have to think about it as much. What was once a problem, which created a lot of stress and anxiety, is no longer that anymore.